The dog wouldn't let anyone near the body. That was the first thing paramedic crews radioed in when they called it through to Sunridge General. Not the victim's vitals, not the nature of the injuries, just that there was a dog. A big one, a working dog, and it was sitting on top of a man who looked like he was dying, and nobody could get close enough to find out for sure. The emergency bay at Sunridge General in Thunder Bay was already moving when the doors hit the walls. Gurneys rolling, monitors being prepped, a resident on the phone with someone who wasn't listening fast enough. The kind of organized chaos that looks like it might tip over at any second, but usually doesn't, because people who work trauma floors develop a sixth sense for the exact edge of catastrophe. Nora Callahan was restocking a crash cart at the end of the bay when the ambulance backed in. Dog before she saw it. Not barking. That was the thing. It wasn't barking or growling or doing any of the things you'd expect. Just a low, sustained sound from somewhere deep in its chest, the kind of sound that said, "I will end this if I have to," and meant it. The paramedics had left a 3-foot gap around the gurney. Nobody was touching the patient. Looked up. The man on the gurney was wearing shredded tactical pants and a compression shirt that had been partially cut away in the field. Blunt trauma to the left side, that much was obvious from the bruising already blooming purple and yellow across his ribcage. Possible internal bleeding. Respirations too shallow. Color going wrong. And on top of him, front paws on the man's chest, hindquarters on the gurney rail, sat a German shepherd in a working vest. Eyes moved constantly, tracking every hand that came within range. Animal control is 20 minutes out. Someone called from the nurse's station. "He doesn't have 20 minutes, the charge nurse said. Victor Osi, senior attending, stood at the edge of the acceptable zone with his arms crossed. He was good. Nora had seen him work fast and clean under conditions that would have rattled most people. But he was also looking at the dog the way most people looked at things they hadn't been trained for. "Hold it," he said. "We'd have to get close enough to sedate it," the paramedic said. She was still holding a clipboard. She hadn't put it down. Then someone get close enough. Maybe nobody moved. Nora set down the supplies she'd been sorting and walked toward the gurney. Say her name, Callahan, the way people say someone's name when they mean stop, but she didn't stop. She moved slowly, no sudden shifts in weight, no direct eye contact, hands low and visible, fingers relaxed. The dog's head swiveled toward her when she got within 6 feet. She stopped there. "Hey," she said, quietly enough that only the dog could really hear her. "Hey, it's okay, I know. You've been doing your job. You can let me help now." The dog's ears went forward. It was reading her posture, her breathing, the pace of her approach. Nora had learned a long time ago that you couldn't fake calm. You either were or you weren't, and animals always knew the difference. One step closer and crouched down, putting herself below the dog's eye level. Shepherd's nose dropped toward her hand. It sniffed once, twice. Then it exhaled, a long, slow breath, and stepped off the patient's chest to the floor beside the gurney. Room released a collective breath it hadn't known it was holding. Nora straightened and put 2 fingers on the patient's neck, pulse thready but present. Airway compromised on the left side. She turned toward the trauma team. "He needs a chest assessment and a portable X-ray now. Someone get me a 16 gauge and 2 units of O-neg. And somebody please pick that crash cart back up." Well, she said it the way she said most things, evenly, without looking for confirmation, and the room started moving. Osi was beside her in seconds. Whatever he'd been about to say about staying in her lane seemed to have been replaced by something more practical. He called for imaging. He called for a surgical consult. He worked, and Nora worked beside him, and the dog sat at her feet the entire time with its chin resting on its front paws, watching its handler's face like it was waiting for him to wake up. Alone in the bay said quietly, "Who is she?" Nora didn't answer. She was focused on the patient's airway and didn't have time for the question. She wouldn't have answered anyway. That was the thing about Sunridge General. It had a way of making certain people disappear into the background. The ones who didn't talk loudly in hallways, or put their name on things, or need to be seen doing the work in order to feel like they were doing it. Nora had been on the medical floor for 3 years, and she could count on one hand the number of physicians who remembered her name without looking at her badge. She'd stopped minding it a long time ago. Invisible meant you could move fast. It meant no one stopped you to ask questions you didn't have time to answer. She got the patient stabilized enough for transport to imaging and stayed with the dog while the trauma team wheeled him through the bay doors. The shepherd, there was a tag on its vest that read Scout. Watched the gurney go, and then turned to look at Nora with an expression she could only describe as deliberate. "Well, he's going to be okay," she told it. "You did good." Well, Scout's tail moved once, low and controlled, like it wasn't sure yet whether optimism was appropriate. Nora found some sterile saline and gauze and cleaned a cut on the dog's left shoulder that was crusted with something she didn't want to look at too closely. Scout let her work without flinching. It kept its eyes on the door. The door opened about 10 minutes later. Not a nurse or a resident. A woman in a gray blazer with a lanyard from an organization Nora didn't recognize, and behind her, a man in his 40s in a navy jacket with RCMP markings on the shoulder. "Callahan," the woman said. Looked up. "That's me. Staff Sergeant Diane Wilder, Major Crimes. This is Constable Bergeron." Wilder looked at the dog, then back at Nora. "You handled the animal in the bay." "Or, I did. I need to know who touched that patient before the paramedics arrived. His belongings, specifically, he was carrying something, a hard case, roughly this big." She held up her fingers, black, unmarked. Or stood, peeling off her gloves. "I don't know anything about a hard case. We were focused on keeping him alive." "He's a member of an RCMP integrated unit," Bergeron said. "What he was carrying is sensitive. If it was accessed before we got here." "Wasn't," Nora said. "No one got near him except me, and I was focused on his airway." Wilder studied her with the particular patience of someone who did this for a living. "The dog responded to you." "Yes. Working dogs don't usually do that with strangers. I know how to read them." Nora met Wilder's eyes. "Is there something specific you need from me, or?" "Right now." Wilder pulled out a card and set it on the counter. "But stay close. We'll need a statement." Left, Scout watched them go. Nora looked down at the dog. Scout looked back at her with the focused attention of an animal that had decided she was the most trustworthy person in the building. "I know," Nora said. "Me too." Liner, she went back to her floor. Plus, the rest of the afternoon passed the way afternoons usually did. Chart notes, medication passes, a post-op patient who kept removing his telemetry leads, a diabetic assessment that took twice as long as it should have because the patient had questions and Nora believed in answering them properly. She did her job. She kept her head down. She didn't think about the man in the trauma bay or the dog or the RCMP sergeant with the careful eyes. Wasn't. She was almost convincing herself it was over when her charge nurse, Patricia Lund, appeared in the doorway of the supply room with an expression that meant it wasn't. "OC wants to see you. I'm in the middle of a restock." "Or," he said now. OC's office was on the 3rd floor, neat and spare in the way of people who spend very little time in their offices. He was standing when Nora came in, which she'd learned meant the conversation wasn't going to be long enough to sit down for. "It was good work in the bay," he said. "Ulst, thank you. I want to ask you something, and I'd like an honest answer." Oldered. Nora waited. "Ul knew what you were doing down there, not just with the patient, with the dog. Where does that come from? And around working dogs." Aura. He said it without inflection, but with the particular weight of a person who isn't going to let something go. "I have worked with a lot of nurses. Good ones. They don't walk into a room with a military-trained animal and crouch down and talk it off a critical patient like they've done it before. So I'm asking again." It was tight. "My file is on record with HR." "I know what's in your file. I'm asking what isn't." "Lee, with respect, Dr. Osazi, if you have concerns about my qualifications, I won't have concerns about your qualifications." He sat down, finally, which meant this was going to be longer than she'd thought. "I have concerns about whether you're going to be a problem for this hospital. An RCMP officer is in our ICU under federal hold. There are plainclothes investigators on every floor, and the only person in this building that dog will sit still for is a med floor nurse who says she used to work around animals. He looked at her steadily. Understand why I'm asking. Boldly, Nora understood. Understood that she wasn't going to answer. Not honestly, not yet. My distance from the patient, she said. If that's what you're asking. O.C. looked at her for a long moment. It's not, but I'll settle for it. He picked up his pen. Get back to your floor. She made it to the elevator before her hands started to shake. She held them flat against her thighs, waiting for the feeling to pass. It always did. That was the thing about having spent 4 years in circumstances where shaking wasn't an option. You got very good at delaying it until you were somewhere private. The elevator opened. Scout was sitting in the hallway. Nora stared at the dog. The dog stared back. How did you get up here? Oos. Scout stood and turned toward the stairwell with the purposefulness of an animal that had a destination in mind. Nora followed, because apparently that was what she was doing now. The ICU was 2 floors up. Scout led her there without hesitation, past the nursing station, down the corridor, and stopped outside room 4. Through the observation window, Nora could see the officer. Still intubated, vitals steady on the monitor. Younger than she'd expected him to look at rest. 30, maybe. Dark hair, jaw rough with several days of growth, hands that were calloused in ways that told a story about the kind of work he usually did. Scout pressed its nose to the door. Nora checked the hall and opened it. While she was reading the chart, no name listed, just a provincial case number and the words Federal Hold Restricted Access when the door opened behind her. Wilder and Bergeron. And a third person, a man she hadn't seen before, broad-shouldered and quiet in a way that suggested he chose it deliberately. Callahan, Wilder said. It wasn't a question. Led me, Nora said. Wilder looked at Scout. Scout looked at Wilder. The dog did not appear apologetic. Sighed, Wilder said. Went into a small conference room at the end of the hall. Wilder sat across from Nora. Bergeron stood by the door. The third man, he didn't introduce himself, stood at the window with his arms crossed. Hold your file, Wilder said. File is with the hospital. File. She set a folder on the table but didn't open it. Nora Ann Callahan, born 1992 in Kenora, enlisted with the Canadian Forces in 2013. Combat medic training, Borden, 2 tours with JTF-2 support in active theater, Mali. Then a classified posting in 2017 that I can't discuss in this room without a different clearance level. Honorable discharge in 2019. Wilder folded her hands. Started nursing school in 2020. Completed in 2022. Hired at Sunridge General 1 month after graduation. The room was quiet. Dog has been through operational deployments in 2 countries, Wilder said. It doesn't accept strangers. You want to tell me again that you've just been around working dogs? Nora looked at the closed folder. She knew what was in it, or what wasn't. The parts that mattered had been redacted down to almost nothing before her discharge. She'd made sure of that. Officer in that room, she said. Who is he? Holt, that's not. My help. Nora looked up, then tell me who he is. Wilder exchanged a glance with the third man. He gave a small nod. Oral James Rudd. Joint Forces operation embedded with a task force investigating an arms trafficking network that's been moving product through the northern corridor. Highway 11. Remote staging areas, cross-border transfer into the U.S. He'd been in the field for 6 weeks and was 3 days from extraction when someone found him. Case he was carrying. Chain of custody documentation, encrypted drive, and a physical record of transactions going back 4 years. Enough to take down the network and the people financing it. Someone went through a lot of trouble to stop him from bringing it in. Nora thought about the bruising on Rudd's ribs. The kind of bruising that didn't come from a fall. Lord, who found him? Anonymous call to Thunder Bay detachment. Just a grid coordinate and the words man down. And the case? On him when paramedics arrived. Wilder paused. Scout wouldn't let anyone close enough to take it. Or looked at the folder. What do you need from me? Right now, the dog won't settle. It's interfering with the ICU nursing team. They can't monitor the patient properly, because every time someone approaches the bed, Scout goes up. We've tried the handlers from the unit and it doesn't respond to them. We've tried sedation and it's too alert. Wilder's voice was careful. You're the only person in this building it's accepted. Want me to sit with the dog. Want you to stay close to the patient until he's stable enough to move. We're transferring him to a secure facility in Sudbury once he's off the ventilator, but that's probably 48 hours. In the meantime, this case is active. The people who put Rudd in the ground are still out there. And the evidence he was carrying is the only thing that holds this whole thing together. Nora was quiet for a moment. "Well, I had a life I left behind," she said. "Boy, no. Well, I built something here that doesn't involve any of this." "Well, I know that too." Outside the window, the city was gray and flat under October cloud. Lake Superior was visible in the distance, dark and cold and enormous the way it always was this time of year. 48 hours, Nora said. 48 hours, Wilder confirmed. 1. Nora looked at Scout through the conference room glass. The dog was sitting in the hallway, watching the door to room 4, with the concentrated patience of something that didn't know how to give up. "Boy," she said. The first night was quiet. Nora sat in a chair beside Rudd's bed, and Scout settled on the floor with its head between its paws, and the monitors beeped their steady reassurance, and nothing happened. Nora updated charts on a tablet, checked Rudd's vitals every half hour, adjusted the sedation drip once when his heart rate climbed. The ICU nurses were grateful and slightly bewildered and gave her a wide berth. At 3 in the morning, Scout lifted its head. Or Nora was on her feet before she'd consciously registered the movement. The hallway outside was empty. The nursing station was unmanned. Shift change, 2 minutes, standard. But Scout's ears were up, and its body was angled toward the service corridor at the far end of the unit, and that was enough. She grabbed the in-room phone and called the desk. "This is Callahan in 4. Get Wilder up here." "Sergeant Wilder isn't." Or, "Get her now." Or, she hung up and moved to the door, cracking it an inch. The service corridor light was off. It was supposed to be on. Motion activated, it should have stayed lit for 10 minutes after anyone passed through. Someone had killed the sensor. Closed the door and locked it. She checked the room fast. Crash cart, IV poles, the monitor's power cable, a bedside tray on wheels. She wasn't armed. She'd left all of that behind in 2019, and she hadn't missed it, not once, right up until this moment. Was at her side, pressed against her leg, body rigid. "I know," she said. Door handle moved. Positioned herself to the left of the frame and braced. Scout dropped low, ready. The handle moved again and then stopped. Wilder's voice came through from the hallway. "Callahan, it's clear." Nora exhaled and unlocked the door. Wilder came in with Bergeron and 2 officers she hadn't seen before. There was a smear of something dark on Wilder's jacket that she didn't comment on. "Was someone in the service corridor," Wilder said. "He's in custody." One? Confirmed. "We're sweeping for a second." Nora looked at Rudd. Still under, vitals unchanged. Scout had moved back to its position by the bed. "Well, this facility is compromised," she said. "Agreed. We're moving him tonight." "Not stable for transport." "Well, he's not stable to stay." Looked at the monitor. She ran the numbers in her head the way she always had, the way they'd trained her to do in circumstances where the choices were between bad and worse. "We'll need a portable vent and a medication pump," she said. "And someone has to ride in the transport who knows what to watch for." "Up." Wilder looked at her. "Coming," Nora said. It wasn't a question. The transfer took 90 minutes to arrange and 20 minutes to execute. An armored van, 2 escort vehicles, a medical bag Nora had packed herself because she didn't trust anyone else to do it the way it needed to be done. Rudd was moved with the efficiency of people who'd done this before, and Scout jumped into the van without being asked and settled beside the stretcher, like it had always known this was where it would end up. Order. They were 40 minutes outside the city when Nora noticed the headlights behind them. Well, she didn't say anything right away. She watched in the mirror on the van's side panel, visible from her position near the back, and counted vehicles and noted the intervals and waited until she was sure. Wilder. I see them. Wilder was already on the radio. What followed was the kind of 30 minutes that don't translate well to language. Evasive routes through highway interchanges. A decision to abandon the secondary escort vehicle and split the pursuit. A moment where the van took a curve too fast, and Nora had one hand on the medication pump and the other on Rudd's shoulder, and Scout was braced against the side panel doing the same thing with physics that Nora was doing, with effort, holding on, staying close. Rudd's blood pressure spiked. She adjusted the drip. His heart rate came down. She kept talking to him, quietly, the way she'd talked to patients in the field when there wasn't anything else she could offer them. Just a voice that said someone was there, someone was paying attention, someone wasn't going to look away. Pressed its nose to the back of her hand. "Okay," she said. "We're okay." They reached the Sudbury facility just before dawn. Secure, federal, the kind of building that doesn't have a sign outside. Rudd was transferred to a surgical suite, while Nora stood in a white hallway under fluorescent lights and let the adrenaline leave her body slowly, the way it always did. Not all at once, just a degree at a time, like a tide going out. A man in a suit found her there an hour later. He introduced himself as Deputy Commissioner Fournier, and he had the careful manner of someone who spent most of his time thinking about things people weren't supposed to know. "We've been looking at the drive Corporal Rudd was carrying," he said. "The documentation is extensive. Financial records, shipping manifests, communications intercepts. It identifies 8 individuals in the organization's upper tier and 3 in positions of federal oversight." He paused. "One of them is a name you'll recognize." For a document. Nora read it twice. Holt. The name was someone she had worked alongside in 2017. Someone she had trusted with information that had later gotten 2 members of her unit killed in circumstances that were ruled accidental. Her hands were very still. "Knew," she said. "We suspected. We couldn't prove it until Rudd." "For how long?" 2 years. She handed the document back. "What do you need from me?" "You were in theater in 2017 for the operation where the leak occurred. You were never asked to testify because the investigation was closed before it reached that point. We're reopening it." Fournier looked at her steadily. "Your testimony would close the case." Nora thought about the 3 years she'd spent at Sunridge General, the patients she knew by name, the rhythms of the floor, the charge nurses, the way the light came in through the window of the break room in the late afternoon. The life she had built out of the pieces of a previous one. "Left that life behind," she said. "I know. Want to go back to it." "Asking you to go back," Fournier said. "I'm asking you to finish one thing, then it's done, sealed, and you go home." Scout appeared from somewhere down the hall and sat at Nora's feet. She looked down at the dog, at its steady dark eyes, at the patience it held like something physical in its body. Saint Macan, she thought about Rudd in the transport van, 37 years old, and half the way gone, holding on because somebody was holding the line beside him. She thought about 2017, about the night she'd figured out that something was wrong and hadn't been able to prove it fast enough, about the 2 faces she still saw sometimes when she closed her eyes in the wrong kind of dark. "Where's the hearing?" she said. It was held in Ottawa 10 days later. Closed session. 14 people in a room that had probably never made the news and never would. Nora sat in front of a panel she wasn't introduced to by name and answered questions in a clear voice for 3 hours. And when it was done, she walked out into an October afternoon that smelled like dead leaves and cold water. Wilder was waiting outside. "Done," Nora said. "Done," Wilder confirmed. "Arrest warrants are issued. He'll be in custody by this evening." Put her face up to the sky for a second. The clouds were the color of a lake in November. "Bud," she said, "how is he?" Asking about the dog. Almost smiled. "Tell him the dog is fine." She went back to Thunder Bay 3 days after that. She drove. She needed the hours on the highway, the particular emptiness of northern Ontario in autumn, the way the birch trees went gold, and the lakes got dark, and the sky got enormous. She needed the space to leave behind what she was leaving behind, and arrive somewhere as just herself. Tricia Lund was at the nursing station when Nora walked back onto the floor. Callahan. Lund looked her over. You look like you drove 6 hours. 1. With the construction on 17. Lund handed her a chart. Room 6 is a post-op hip, getting fussy about physio. Room 8 is a respiratory, needs discharge paperwork. And there's a transfer from Sudbury in room 3 that someone specifically requested you oversee. Worried, Nora stopped. She looked at the chart. Corporal James Rudd, transferred for recovery and physiotherapy, Thunder Bay Regional. Scout's name was listed in the notes as an approved support animal, which was not a standard notation, and had clearly been added by someone with the authority to make unusual things happen. She went to room 3 and knocked on the open door. Rudd was sitting up, which was farther along than she'd expected. He was still gray with the effort of breathing, and his left side was taped and wrapped, and he had the look of someone doing the math on how long the next 3 months were going to take. Scout was on the floor beside the bed, and when Nora came through the door, the dog lifted its head and its tail moved twice. Callahan, Rudd said. His voice was rough from the tube. Rudd. She checked his chart. You're not supposed to be sitting up yet. Well, I know. Well, why are you? Those lying down is boring. He watched her move to the monitor. Wilder told me what you did. Wilder talks too much. What you wrote in the transport, that you kept me stable. He paused. She said you testified. Nora set the chart down. That's not. Callahan. He said it the same way O.C. had, with the weight of something that wasn't going to be dismissed. Thank you. Well, she didn't know what to say to that. She hadn't been looking for it. She never had been. You would have done the same, she said. Colby. He scratched Scout behind the ear, but I didn't have to. She went back to her floor. She had charts to update and medications to reconcile, and a post-op patient who was going to remove his telemetry leads the moment she looked away. She clipped her badge to her scrubs, pulled on a fresh pair of gloves, and got back to work. She was halfway through the afternoon when Dr. O.C. appeared in the hallway and fell into step beside her. Heard you were back, he said. It was only gone 2 weeks. Long 2 weeks. He was quiet for a moment. The hospital board wants to offer you an expanded role, trauma coordination, working between the floor and the ED with law enforcement liaison when it comes up. He glanced at her. Dr. Rashid in critical care is retiring in the spring. She's asked specifically that you be considered for a lead clinical role on the transition team. Walking. Now, why are you telling me this? You've earned it. O.C. looked at her with the directness of a person who had run out of patience for things being said sideways. You've been on this floor for 3 years, and for 3 years I've watched you do work that most people can't do, and watched other people get the credit. That's on us, and we're asking if you're willing to let it be different. Hallway was ordinary. Beige walls, fluorescent light, the distant sound of a monitor somewhere doing its job. She had spent 3 years learning to disappear into exactly this, into the routine of it, the steadiness, the sense that she was small enough that nothing could find her. She thought about Scout, about the way it had stepped off Rudd's chest and come to her feet. Not because she'd commanded it, but because it had looked at her and made a decision. Animals were good at that. They didn't care about rank or history or what you'd left behind. They just looked at you and decided whether you could be trusted with something that mattered. Think about it, she said. Ozzy nodded. He walked away. Nora stood in the hallway another moment, then kept moving. She had a patient in room 6 who was going to try to skip his physio if she didn't get there first. 6 months after that, on a Tuesday afternoon in April, Nora got a package at the nursing station. No return address. Inside was a photograph and a folded note. The photograph showed a unit in the field, 8 people in kit, somewhere brown and flat and distant. She recognized the year from the equipment, 2017. She was in it. Third from the left, looking at something outside the frame. Note said, "We got him. All of them. It's done. Thank you for finishing it, J. Rudd." Back of the photograph, in different handwriting, someone had added, "You were the one who told the truth when it cost something. That matters." Nora held the photograph for a long time. Then she put it in her locker. between her spare set of scrubs and the card her first patient had sent her after discharge. Handwritten, loopy cursive, just a thank you and a name she still remembered. Work. She went back to work. There were 3 new admissions on the floor and a family waiting in the hallway with questions that deserved real answers, and a young nurse named Chen who had only been on the unit for 6 weeks and was still learning that staying calm under pressure was a skill you built, not something you were born with or not. Nora stopped and showed her how to read a patient's color before you read the chart. She showed her what to watch for in a breathing pattern that didn't look wrong but was. Work. She showed her that the work was the thing, not the recognition, not the title, not who was watching. "Will you stay so steady?" Chen asked, not for the first time. People thought about it the way she always did when people asked. "Honestly, you just keep showing up," she said, "even when it's hard, especially then, and eventually steady stops being something you have to try for. It's just who you are." Slowly, taking that in. Nora picked up the next chart and kept moving down the hall. Outside the window, the lake was gray-green and enormous in the way it always was in spring. Like something just waking up, deciding what it was going to be. Some people were meant to disappear. Nora had thought for a long time that she was one of them. Or she was wrong. I keep thinking about the moment Scout stepped off that man's chest. Because it was dramatic, though it was, but because of what it meant. That dog had been through things most people will never see. It had been trained to trust almost no one, and to protect the one person it did trust with everything it had. And then a woman walked into the room, crouched down, held out her hand, and the dog made a decision in about 30 seconds that a room full of trained professionals couldn't make happen in 10 minutes. Bulls don't respond to titles. They don't care what's on your badge or how many years you spent in school. They read something deeper, whether you're present, whether you're honest, whether you actually know what you're doing or you're just performing it. Scout knew. And I think that's the part of Nora's story that stays with me the most. She had spent years making herself small, not because she wasn't capable. She was more capable than almost anyone around her, but because she had decided that being seen was dangerous. She'd come home from places that cost her something real, and she'd built a quiet life, and she'd told herself that was enough. And in some ways it was. She was a good nurse. She showed up every day and did the work and cared about the people in her care the way you can only care when you've seen what it looks like when no one does. There's a difference between being invisible because you choose it and being invisible because you've let fear make the choice for you. Nora had to learn that difference the hard way, in the back of an armored van at 3 a.m. with a man's blood pressure spiking and a dog pressed against her leg and no one else to hold the line. What strikes me about people like Nora is that their integrity doesn't switch on when someone's watching. It was already there, years before anyone noticed. She didn't cut the IV line or abandon the patient when OC told her to stay away. She didn't lie to Wilder about what she knew, even when the easier thing would have been to say nothing. She'd built her character in the years when it didn't matter, in the repetition of showing up and doing right by people who would never know her name. And so when the moment came that actually counted, she didn't have to think about what to do. She just did it. That's the thing about how we become who we are. It's not in the big moments. It's in the 100 small ones before them. Every time you tell the truth when a lie would be easier. Every time you stay with a difficult problem instead of walking away from it. Every time you show someone, a patient, a colleague, a dog, that you are exactly who you appear to be. That consistency compounds. Eventually, when something hard lands in front of you, you discover that you already know how to handle it. Not because you were born that way, but because you chose it, quietly, over and over again, when no one was keeping score, or went back to her floor. She taught a young nurse how to read a patient's breathing pattern. She answered questions properly because she believed people deserved real answers. She kept showing up. A small thing. That's everything.